Hi everyone, Sarah Stackhouse here with RNCN, and I'm here back with Dr. Sally Fryer Dietz with Integrative Pediatric Therapy and Integrative Concussion Therapy. We are here doing part 2 of the baseline test assessment. So can you talk a little bit about what the baseline assessment test is and why it's so important?
So we love doing baseline testing for a couple different reasons. One, you get a good baseline of where you are in the event an injury should occur. You know what you have to do to get back to it. But the other thing is it's a great tool to use for safety on the field and sports performance. If you have a good baseline test ahead of time and there are red flags that show up, it's a whole lot easier to treat them to be preventative than it is to have to treat them later when you don't really know what it was that caused it in the first place.
Yeah, absolutely. What are some of the things that we did last time? And you can scroll through RNCN or visit Sally Fryer Dietz or Integrative Pediatric Therapy Facebook pages to see those prior. But what did we do last time, and then what are we expecting to see today?
So last time we did the impact testing, which is a neurocognitive test that is most often given in schools anyway, and that for the most part is if somebody does have a baseline test, that's usually the only thing they do get because they don't know about some of these other things. But we look at a vision screen, see what's happening with visual movements in the eyes. Mm-hmm. We did Dynavision testing, which was looking at peripheral vision and safety on the field, reaction time. Are you able to take in everything around your environment, and how quickly can you get to a trigger? Right. And what else did we do? I think that was, and balance. We did your biodex, looked at the balance reactions, where do you stand, how do you hold your body? And today we're going to do exercise on the treadmill exercise testing, which we do for baseline, as well as in the event of an injury. We want to be able to prescribe the right amount of exercise following an injury. Right. And we're going to do some interactive metronome that looks at attention and focus and cognitive functioning, because that's something that people complain of a lot after an injury, foggy thinking and things like that. So that's another tool that really helps with attention and focus and also sports performance, doing better on the field.
Okay, perfect. And if people have questions there, they can just comment along and we can ask. I'm going to hop behind the camera and kind of let these ladies take it away. So let's go ahead and get started. You might see a little wiggling here. Hold on one second.
So we're going to go over to the treadmill.
Okay, 1 second. There we go. All right, so I'm going to follow you.
Okay.
All right, so maybe if you could explain kind of what's going on here.
So Melanie and Kayla are doing the Buffalo Treadmill test. That's a test that we look at that measures exercise performance and strength. And Melanie, why don't you share what it is that you're doing right now?
And hold on 1 second.
Can we hold that?
Yeah. 1 second.
Okay, we think Melanie's in. There we are.
All right, there we go.
The Buffalo Treadmill test actually has some roots in a cardiac stress test. Oh. So basically you're putting them through a graded exercise progression, which increases their exertion level with each minute. So the first minute, they're walking at a normal pace. There's 0% incline, and gradually you increase that incline to the point to where they're jogging. Oh. So this, in a baseline assessment, will tell us how close you can get to your heart rate max, your exertion level. Okay, so what your cardiac endurance is and your cardiac efficiency is. You may even, before you have a concussion, produce symptoms on this: a headache, excessive fatigue, dehydration, dizziness, even with those symptoms. Post-concussion, we're looking at your exercise tolerance. So this is perfect for those kids that they feel like their symptoms have improved, but they still can't tolerate that return to play, the exertion piece of it. So what we'll do is we'll do the graded exercise progression and figure out at which level, which heart rate they become symptomatic. And then we give them an exercise prescription below that threshold to start training their cardiac endurance. So we'll say, 60% of that highest heart rate that they got to is your new training zone. And I want you to start at 5 minutes, 10 minutes, build up to 30 minutes. We'll redo the test a week or so later and figure out what their new cardiac demands are, and we'll continue to progress that on a week or bi-weekly basis.
So is the starting point for that heart rate, is that different for every person, or is it the same for the person?
So your heart rate is definitely dependent on you personally and your athletic levels. Our higher level athletes have really low heart rates because they're very good cardiac health. Mm-hmm. some of our younger athletes that are maybe 8, 9, just getting into more aggressive sports, their cardiac efficiency might not be that great, especially if they're playing one sport only on Saturdays, and one practice a week. Post-concussion, we also can use this for differential diagnosis. So do you have a cervical involvement or neck involvement compared to physiologic or brain healing component to exertion? So we can use this to have a better clinical picture and progress with our treatment a little bit more effectively too.
Okay, so what are kind of the next steps here?
So I'm going to go ahead and increase her grade.
Oh, we're making you jog, or is she going up?
So normally we would do this every minute. We would gradually increase this. I'm going to get her to a light jog. And each minute you take their blood pressure and their heart rate. And that's telling you, is she having an appropriate response to the exercise that you're putting on her? So if I see a quick elevation in heart rate or a drop in blood pressure, abnormal response to exercise. When you have a physiologic component and your brain is under increased stress or poor efficiency, then you're going to have really low tolerance to this. You're going to become symptomatic a lot quicker than your heart rate can elevate. But if you possibly have like a cervical component, you'll be able to reach pretty close to your heart rate max.
Yeah, absolutely. Yeah. So what's the highest you'll go up to? Is it just kind of you see whenever the person is tired, or how does that work?
So some of my higher level athletes, my pro athletes, make it to 10 minutes.
Oh, wow.
12 minutes. But just like a cardiac stress test, the intensity is pretty quick on purpose to see that cardiac response. So
interesting.
We will monitor them every minute that they're on the treadmill, and then once they become symptomatic, we'll slowly lower them back down to a cool off. So they'll walk for another 5 minutes or so, and we'll monitor their vitals and see how they come down from exercise to make sure that's appropriate and not prolonged. Cardiac efficiency is also in your recovery time. So if it's taking you 30 minutes to come back down to baseline, that's a decrease in cardiac efficiency. So we have to pay attention to the cool down as much as we pay attention to the exercise test results.
I would never think that. I guess bringing it back down. Okay, so are we monitoring right here?
Yeah. So we're looking at measuring her blood pressure.
Okay. So is there an ideal number, or is it just dependent on every person?
And that's again why you want to have a good baseline test. It's going way up, and then it'll come out. So hers with exercise is 170/68, which is great. That's appropriate for what she's been doing on the treadmill. But if you had a good baseline, it's going to tell you what's normal for you, so that when you do exercise, then we have something to measure against. So everybody is unique and different, and your exercise response is going to be appropriate to what's going on with your body.
And that's why we're doing this, right?
That's right. And even for our older individuals and athletes, they may be on medications. And medications can affect what's going on with your heart rate and your blood pressure. So how that plays into it is also going to be a big piece. So the other thing we wanted to show you, as far as some baseline testing, is you want to do the interactive metronome?
Yes.
So we can look at that.
And I hear that's similar to a game, right? It looks like a game?
It's like a game. We use this a lot in our developmental pediatric side. It's great for attention and focus. So it's one tool that actually has a lot of science behind it that's been scientifically proven to have benefits for kids and adults who are diagnosed with ADHD. Because of the attention and focus components. It's the only tool that does not involve medication that actually has lots of science behind it. So we use it for kids with attention deficits, but we also use it for sports enhancement, sports performance, for rehab training afterwards. We have our Fit Lights set up so you can kind of see how we might take some of this information and use it later for training or for rehab purposes. And it really helps to increase reaction time, attention, focus, and the kids typically really like it, because there's different games that we can program into it, whether it's basketball or golf or soccer. I think you're doing soccer over there. So anyway, it's a cool tool.
So where should I be looking?
Sure. So you
Well,
can
actually,
look at the screen.
there we go.
So,
Okay.
It is a specific tool to give you neurofeedback. So you get neurofeedback in your ears through guided sound. So if you're too early or too late, you get a different sound that tells you that. As well as right now I have some visual feedback for her. So if she's to the left of the screen, she's going too fast and she needs to slow down. And when she's to the right of the screen, she needs to kind of speed up. She's prolonging, going too slow. So the equipment, actually, the software is down to the millisecond. So it really refines your movement. So the attention and focus piece can come from the amount of time that you complete one of these activities. So we can go up to 8 to 9 minutes of sustained attention. She's doing something that's static. So she's standing and she's doing a little bit of bilateral coordination where she's tapping alternating toes. But we can also plant those triggers on the floor and have her sidestepping or shuffling and getting to those triggers. We can pair it with a basketball shot type thing where you step on one like you would plant your foot and shoot and hit a target up top above your head. So we can work on more sport specific type coordination along with the beat. Like Sally said, it's mainly for increased focus and attention, but it's based on cognitive efficiency and sustained attention.
Yeah, another thing, what you're noticing right now is she's having to move very slowly. And this is something that we see a lot of times in both the developmental pediatric side and in the concussion side, is that as long as somebody's moving fast, it might be a little bit easier. But when you have to slow down your motions and get that timing just right, it takes a lot of attention and focus to do that and coordination. So she's really working very hard in her brain right now, where both sides of her brain are communicating in order to get the scores that she's getting. In the baseline testing, it's also very informative in telling us how does that person process information. And if they have a pattern of always hitting things on the left side of the screen, or that means they're getting to the trigger too early, then that means they tend to be a little bit more impulsive and have to slow things down a little bit. If they're triggering it to the right side of the field, then that means they might have a slower processing speed, so they're going to have to learn how to speed up their reaction time. So through thousands and thousands of repetitions, then your brain kind of readjusts for those tendencies to either be too slow or too fast, and that's how it really builds on each other.
It has a huge piece in organization and time management as well, because its whole focus is on timing and building your timing reaction. It also helps with people that have poor sleep quality or difficulty sustaining sleep, especially some of those kids that are having difficulty falling asleep and calming down, and there's not an anxiety component to it. It's just that their circadian rhythm is often altered, and we need to re-educate it. So it's had a lot of benefit, especially in our older adults that have some sleep quality issues, some cognitive memory issues, sustained focus and attention, loss of train of thought, a lot of benefit to it.
Yeah, and even fall prevention in our older clients.
So you can see here it gives us a task average, and there's norms per age group, and then it tells us super right-ons are how often she was on the green, and she was early majority of the time, so a little bit more of the impulsive. So we're trying to slow her down with this training. So in the beginning, you meet the athlete where they are, so you find out what beat per minute they're most successful, and then you try to bring them down. Same thing with those that are a little bit more cognitively slower in their processing and their actions. We'll start them really low with a lower level beat or metronome beat, and we'll work on progressing them up to increase that cognitive speed. Really neat.
So we can take the information from here, and we can go in our exercise training, say we saw some certain tendencies Tashi was doing, or she's a higher level concussion rehab patient. Now she wants to get back on the field and wants to be successful and safe so she doesn't get hurt again. So we can take this same beat and set up a track, and we use this for a lot of our professional athletes as well, where we have these lights. They're called fit lights, and they're at different levels, and we'll create different patterns and activities where she has to get to those lights quickly. So she's having to problem solve and use her body in a way that makes it more efficient and kind of challenges her nervous system more than she's been challenged when she's just going through a regular rehab. So
these are super, super sturdy lights. So they come in casings where I can put them on the ice hockey field, ice rink, and we can have pucks come at them. We can do training fields on the soccer field where I have them either swipe or have to tap it, hit the ball to it. So we can do a lot of drills, and that gives us, again, feedback to the millisecond. So I can look at their reaction time very specifically.
So a puck could really hit this and it would be fine?
Yes.
Oh, gosh.
Yes, it's pretty awesome. So Miss Kayla is in the middle of the circle, and this is utilized for me for peripheral awareness and working on scanning your environment without symptoms. So kids that have a secondary vestibular component, an inner ear component that may get dizzy with quick head movements, I want to make sure that not only can they do my exercises, but that specific vestibular reflex is very specific to sport and training it for sport. So then I'm going to set her up in something like this where she's going to have to do some quick moves to get to those lights.
So should I watch her or you or the...
Watch her.
Okay.
Oh gosh, where are they? Oh, Miss Kayla.
Okay, so that's what they look like when they light up?
Let's see.
So they're going to light up at different patterns at different times. So here's like this one. You have to be quick, So they're trying to slow down the pattern so you can catch it. See these lights that are on right now?
Oh.
But you'll see they'll go off randomly in different patterns. So she has to constantly be aware and look around her to see, where the light is and go hit it to.
Got it. So we're just syncing them.
And what I'm going to do is I'm actually going to hand you the microphone so that I can
move
walk around.
Okay,
Yeah.
perfect.
Okay. So here she goes. She's going to do her thing.
So you can see how she's having to scan her environment, and you can imagine after an injury or even before an injury how challenging this might be. Certainly if you have any kind of vestibular issue or even some visual challenges. But she's doing a pretty good job.
The lights go quick.
The lights go quick, and we can change that. We can have them go quicker, or we can have them go slower. Again, matching the individual where they are, and then building from that. But you can see why kids like this, professional athletes really like this. We'll set these lights up in our gyms and have them incorporated into obstacle courses where kids will have to take turns, finding the light and getting it turned off before the next one. So there's a lot of cooperation and timing and precision that goes into it.
And I can have the athlete multitask by kicking a soccer ball back and forth between these lights, or passing a basketball to me, doing any type of lacrosse shot to a certain target. So I've added targets on the wall here and had them throw at a target while they're multitasking this information to simulate them running down the field and having to look back, scan their environment before they pass and shoot. So it gets really neat. You can have a lot of fun.
Yeah.
That's very cool.
So anyway, those are kind of the highlights of baseline testing, that we do, and how we incorporate that into treatment later or before if we identify red flags early, so that the bottom line picture is that people are safer on the field, they do better, they have a complete recovery before going back to a sport or an activity. And
if people have any questions, how can they contact you?
So we have a great website, concussion-therapy.com, that has lots of information on it. Or they can call us at 972-707-3355.
Perfect. All right.
So there you go.
Well, thank you, everyone.
Thanks.
Bye.